Hey there, welcome to our channel. We're thrilled to have you here. In this video, we're going to share some exciting and informative content with you that we think you'll really enjoy. But before we get started, we'd love it if you could take a moment to hit the subscribe button and turn on the notification bell. That way, you'll never miss any of our latest videos. And if you find this video valuable, please consider sharing it with your friends and family so they can benefit from it too. Thanks for tuning in, and let's get started. What is bipolar disorder? Bipolar disorder is a mental illness characterized by intense mood swings that fluctuate between manic and depressive episodes. It affects about 2.8% of the U.S. adult population, or about 5.7 million people. The disorder can cause significant disruptions in a person's daily life, including their relationships, work, and overall well-being. There are three types of bipolar disorder: bipolar I, bipolar II, and cyclothymic disorder. Bipolar I disorder is characterized by at least one manic episode that lasts for a week or longer, or that requires hospitalization. A manic episode is a period of high energy, elevated or irritable mood, and increased activity levels. Bipolar II disorder is characterized by at least one hypomanic episode and one major depressive episode. Hypomania is a less severe form of mania that does not cause significant impairment in a person's daily life. Cyclothymic disorder is characterized by at least 2 years of numerous periods of hypomania and depressive symptoms that do not meet the criteria for a major depressive episode. The exact causes of bipolar disorder are unknown, but it is believed to be a combination of genetic and environmental factors. People with bipolar disorder may have a family history of the disorder or other mental health conditions. Stressful life events, substance abuse, and hormonal imbalances can trigger or exacerbate bipolar symptoms. Bipolar disorder often co-occur with other mental health conditions, such as anxiety disorders, substance use disorders, and eating disorders. Symptoms of bipolar disorder can vary depending on the type and severity of the episode. During a manic episode, symptoms may include increased energy, decreased need for sleep, racing thoughts, impulsivity, grandiosity, and irritability. During a depressive episode, symptoms may include low mood, loss of interest in activities, fatigue, insomnia or hypersomnia, feelings of worthlessness or guilt, and thoughts of death or suicide. Some people with bipolar disorder experience mixed episodes, which involve both manic and depressive symptoms at the same time. Diagnosis of bipolar disorder typically involves a comprehensive evaluation of symptoms, medical history, and family history. Doctors may use diagnostic criteria from the Diagnostic and Statistical Manual of Mental Disorders, DSM, or the International Classification of Diseases, ICD. Treatment for bipolar disorder typically involves a combination of medication, psychotherapy, and lifestyle modifications. Medications used to treat bipolar disorder include mood stabilizers, antipsychotics, and antidepressants. Psychotherapy, such as cognitive behavioral therapy, CBT, or interpersonal therapy, IPT, can help people with bipolar disorder develop coping strategies and manage their symptoms. Lifestyle modifications, such as regular exercise, healthy eating, and stress management techniques, can also help improve mood and overall well-being. It is important for people with bipolar disorder to adhere to their treatment plan and communicate regularly with their healthcare provider. Without treatment, bipolar disorder can lead to significant impairment in daily functioning and increase the risk of suicide. People with bipolar disorder are at a higher risk of suicide than the general population. Suicide prevention strategies for people with bipolar disorder may include medication management, psychotherapy, crisis intervention planning, and support from family and friends. Bipolar disorder can be challenging for family members and caregivers, who may need to provide ongoing support and assistance to their loved one. Support groups and education programs can help family members and caregivers learn more about the disorder and develop effective strategies for managing symptoms and providing support. Children and adolescents can also develop bipolar disorder, although it is less. Bipolar disorder in children and adolescents may be difficult to diagnose, as symptoms may overlap with other mental health conditions or typical behavior for their age group. Treatment for bipolar disorder in children and adolescents may involve a combination of medication and therapy, as well as support from family and school. Some common medications used to treat bipolar disorder in children and adolescents include mood stabilizers, antipsychotics, and antidepressants. Therapy for children and adolescents with bipolar disorder may include cognitive behavioral therapy, family therapy, or social skills training. Education and support for parents and caregivers can also be beneficial in managing the challenges of caring for a child or adolescent with bipolar disorder. In some cases, hospitalization may be necessary for individuals with severe symptoms or those at risk of harm to themselves or others. It is important for individuals with bipolar disorder to have a support system, including family, friends, and healthcare providers. Peer support groups, such as those offered by the National Alliance on Mental Illness, NAMI, can also provide valuable support and connection for individuals with bipolar disorder. Some individuals with bipolar disorder may struggle with substance abuse, which can complicate treatment and increase the risk of negative outcomes. Integrated treatment programs that address both bipolar disorder and substance abuse can be effective in improving outcomes for these individuals. Some individuals with bipolar disorder may also struggle with chronic pain or other physical health conditions, which can further complicate treatment. Healthcare providers may need to coordinate care with other specialists, such as pain management or rehabilitation specialists, to provide comprehensive treatment. Individuals with bipolar disorder may experience periods of stability and remission, but the disorder is typically chronic and requires ongoing management. Regular follow-up with healthcare providers and adherence to treatment plans can help individuals with bipolar disorder maintain stability and improve overall functioning. Self-care and stress management techniques, such as mindfulness meditation and relaxation exercises, can also be helpful in managing symptoms and improving overall well-being. People with bipolar disorder may face stigma and discrimination, which can further exacerbate the challenges of living with the disorder. Increasing awareness and understanding of bipolar disorder, as well as advocating for policies that support access to treatment and resources, can help reduce stigma and improve outcomes for individuals with the disorder. Research on the causes and treatments for bipolar disorder is ongoing, and new interventions may become available in the future. Participating in research studies or clinical trials may be an option for some individuals with bipolar disorder who are interested in contributing to advancements in the field. Overall, bipolar disorder is a complex and challenging illness, but with appropriate treatment and support, individuals with the disorder can lead fulfilling and productive lives. In conclusion, bipolar disorder is a complex mental illness that can significantly impact a person's life. However, with proper diagnosis, treatment, and support, people with bipolar disorder can manage their symptoms and lead fulfilling lives. It is important to seek treatment as early as possible and work closely with healthcare providers to develop an effective treatment plan. Lifestyle changes, psychotherapy, and medication can all be effective in managing symptoms. Family and friend support, as well as resources such as support groups and advocacy organizations, can also be valuable for individuals living with bipolar disorder. Thank you for watching. If you enjoyed this video, please don't forget to hit the subscribe button and turn on the notification bell to stay up to date with our latest content. And if you found this video helpful or entertaining, please share it with your friends and family. Your support means a lot to us and helps us to keep creating more quality content. Thanks again for tuning in, and we'll see you in the next one.